The virus has impacted all of us in terms of how
Absolutely.
we do things and what we do. So the children, they're spending a lot of time
Uh,
in front of the screens, and their whole school year pretty much was in front of a laptop or a computer screen or on a phone or something to that effect. So what
mhm.
impact is that having on their eyes?
Well, what I've seen directly in my practice is that kids who were going to be nearsighted because of genetics or anything in their family, they're progressing a lot more quickly into the more serious nearsightedness. Thicker lenses, a little bit more dry eye. The kids who didn't really need any glasses, and I didn't expect them to have any glasses later on, are finding that they're needing help because all they're doing is staring right there at that screen all day long. Whereas before, at least they would get up, run around, talk to people greater than that laptop distance.
Right. So is there anything at all that can be done about that?
Absolutely, and it would be great. I need to talk to the teachers too. Every 20 minutes, we like to call this visual hygiene. Every 20 minutes, everybody needs to look up away from the screen for 20 seconds, at least 20 feet away. So we call that the 20-20-20 rule. Okay, so every 20 minutes, 20 seconds away, at least 20 feet, and that would help.
Wow, that's interesting. I can use that myself, actually.
Right? You set a little timer. And the other thing is, if they start having problems like burning of their eyes, um, we need to look at the ergonomics of their screen. So the screen should be a little bit lower than your eye level, because if you raise it up too high, you don't blink as often. And so we need that blink in order to keep our eyes nice and lubricated. So setting the screen a little bit lower than what their eye level is would be great.
Wonderful. Now, I also read the masks are causing dry eye.
Yes, it is. Yeah, a mass-associated dry eye. And that's all because we're not getting the recirculation of the air. So we need to start putting in drops if you're having problems like stinging, burning, like something is in your eye. And, sometimes over-the-counter drops will be fine as long as it's not Visine or Clear Eyes. But anything else would be wonderful.
Wow. So much to learn, so much to do. How else has the virus and what we've been dealing with for the past year and a half or longer impacted your patients? What have you seen?
Mainly it's just dryness. And if they were dry before COVID, they're even more dry now. And so we've had to upgrade from over-the-counter drops to prescription drops like Restasis or Xiidra. The other thing is that their eyes are getting tired from staring at the computer for 8 hours a day, whereas before they could at least, move around a little bit. And then there's, some people who are just their eyes, they have a little bit of debris on their eyelashes, and so that causes them to touch their eyes a bit more often. And so we've got to learn to not touch our eyes with our hands right now.
Okay. So any of these things we need to immediately see an optometrist if we're noticing something, or will the eye drops do? What are your thoughts?
I would say you can go ahead and get the drops over the counter, and if you're doing those drops more than 2 times a day and it's not really relieving any of your problems and you're having burning or stinging or even red eyes, then I would definitely call optometrists and make an appointment because there's other ways we can treat that without you struggling and being in pain.
Gotcha. Okay. Is there anything that I haven't asked that you think people should know regarding the virus in their eyes?
There was some talk about the virus can live in the tear film, and there is truth to that. But as long as you keep your hands washed and don't touch your face, then we should be fine.
Okay. Dr. Kristina Ramsey, thank you so much for your time today. I really
No
appreciate
problem.
it.
Thank you. I appreciate it.
Okay. Bye bye.